This exercise is called the horizontal push, also known as the push-up. Some of the muscles that are being used are the pectoralis major, the anterior deltoid, and the triceps brachii. Some of the joint motions that are taking place are transverse extension and flexion in the shoulder joint, transverse extension and flexion in the elbow joint, and ulnar deviation and radial deviation in the wrist joint. The way this exercise is done is the individual needs to lay flat on their stomach with their toes perpendicular to the ground. They need to place their palms under their shoulders flat with their elbows out. Once this is done, they need to push upward while maintaining a neutral spine. After this, they need to allow themselves to slowly go back down to the floor, and then repeat. Some of the common errors with this exercise is that there is no neutral spine, there is asymmetrical strength disunity, or there is hip joint flexion or extension. The ways that this can be corrected are to use a dowel to keep a neutral spine, contract your glutes to help prevent hip movement, or keep your head looking down to prevent cervical bend. This exercise is the squat stance, specifically the back squat. Some of the muscles that are being used are the quadriceps, the hamstrings, and the glutes. Some of the joint motions that are occurring are flexion and extension of the hip joint, flexion and extension of the knee joint, and plantar flexion and dorsiflexion of the ankle joint. The individual starts in a standing position with neutral spine. It is important that they lean on their heels and that their feet are shoulder width apart. They begin by flexing the hips while maintaining this neutral spine. Then they flex the knees and bring their bottom as close to the floor as they can without falling over. Then the individual pushes up to go back into the standing position and repeats. Common errors are a failure to activate the hips first, a failure to keep a neutral spine, or the knees caving in or out. Corrective feedback techniques can be to contract the abdominals before doing anything, to use a dowel first, or to stay leaning on the heels the entire time. This exercise is called the vertical pull, also known as the pull-up. Some of the muscles that are being used are the pectoralis major, the biceps brachii, and the brachioradialis. Some of the joint motions of this exercise are adduction and abduction of the shoulder joint, frontal flexion and extension of the elbow joint, and radial deviation and ulnar deviation of the wrist joint. To begin this exercise, grab the handles of a pull-up bar and place your hands shoulder width apart with a pronated grip. Extend the arms by hanging from the bar with the elbows slightly bent. Slowly pull upwards by bringing in the elbows and the shoulders to the body till the chin is over the bar. Now slowly lower the body in the opposite direction till you reach the start position. Some of the common errors of this exercise are too fast of a pull or a descending motion, kicking the feet to help with the motion, or not getting the chin over the bar. Corrective feedback and techniques can be breathing out during the pull-up and in during the descent. Keep your body from doing any excessive movement. Stabilize yourself by contracting the core and leg muscles. The next exercise is the split stance, also known as the lunge. Some of the muscles that are used in this exercise are the quadriceps, the hamstrings, and the glutes. The way that this exercise is done is by having the person take a long stride forward, making sure that their feet are pointing perfectly straight. Keeping a neutral spine, slowly bend the knee of the front leg while the knee of the back leg goes to the floor, making sure that the back leg raises the heel off of the floor. Once the knee of the back leg gets close to the floor, begin to push back upward and repeat the process. Some of the common errors in this exercise are that the front knee goes past the toe, the back knee touches the floor, or the neutral spine is not maintained. Corrective feedback techniques are to contract the abdominals, look straight ahead to hold the neutral spine, and to do the exercise slowly in order to do it correctly. The next exercise is the single leg stance, also known as the single leg squat. Some of the muscles being used in the single leg squat are the quadriceps, the hamstrings, and the glutes. Some of the joint motions that are taking place are flexion and extension in the hip joint, flexion and extension in the knee joint, and dorsiflexion in the ankle joint. Start this exercise by standing on one leg and bending the knee of that one leg. Place the opposing foot straight out in front of your body while the other leg is bending. Once the foot bends all the way down, push back up and repeat. Common errors in this exercise are a failure to activate the hips first, a failure to maintain the neutral spine, and the knee caves in or out. Corrective feedback techniques would be to contract the abdominals before starting the exercise, keeping your back neutral, and leaning on the heel the whole time.